Hello friend, welcome to my channel 5 Minute Pediatric. Few days back I have asked question related to this figure. So what clinical clues you get from this question? So first of all is age. The age of child is 3 months. So this shows the symptom occur early in life. Second one, we have delayed umbilical cord separation, that it took more than 21 days. So this is classical sign of leukocyte adhesion defect occurring due to defective neutrophil migrations. There is a recurrent omphalitis with no pus formation. This also shows that there is poor or there is absence of neutrophilic migrations or adhesions. There was leukocytosis. WBC count was more than 30,000. This shows that the leukocyte remains in the intravascular compartment. It does not move to the site of infections. Next, flow cytometry shows CD18 absent. CD18 deficiency confirms LAD-1 deficiency, because CD18 is a part of beta-2 integrins that needed for leukocyte adhesion. DHR test normal. DHR, what is DHR? Dihydrorhodamine test rules out chronic granulomatous disease, which shows abnormality. Normal DHR supports leukocyte adhesion defect. Now let's discuss about pathophysiology. So in leukocyte adhesion defect type 1, there is a mutation of ITGB2 gene. This leads to CD18 deficiency, and CD18 is a part of LFA1, that is lymphocyte function associated antigen 1. This is critical for one, neutrophil adhesion to the endothelium. Second, for migration of neutrophil, what we call diapedesis. Without CD18, neutrophil cannot exit the bloodstream, so they remain accumulated inside the blood vessels. So there is a leukocytosis. No pus formations at the infection site. The region remains the same. The neutrophil could not reach there. And there is also poor wound healing and severe infections. So these are the pathophysiology of leukocyte adhesion defect type 1. So now let's move to the management plan. So what is the definitive treatment for this condition? So for restoring CD8 function, this child needs hematopoietic stem cell transplantation along with prophylactic antibiotic to prevent life-threatening infections. We should avoid live vaccines because of immunodeficiency. And this child also needs genetic counseling because it has autosomal recessive inheritance. Hope so you enjoyed these explanations, and I have tried this to make it as simple so that you can learn immunology in a just simple way. At least you can think of immunodeficiency. Thanks for watching. Kindly share these useful contents amongst your colleagues, amongst your friends. Thanks.